the in-person Advocacy Day last week, but from now, for this year, Advocacy Days will be on Zoom. For those that don't know me, my name is Sean Laham from Self Advocates in Leadership, or SAIL. My visual description is a white middle-aged man with a black shirt on. I have a picture of the SAIL logo and SAIL members in the background. Just as a reminder, please use the Q&A box for any questions you have today. It can be found in the More menu. We would prefer you only use the chat today for important links and those that need it for accessibility reasons.
Eric, do you want to introduce yourself?
Yes, thank you, Sean. My name is Eric Mathis. Happy to be here on a great sunny day where I am. Ready for Advocacy Day, and I'm wearing a shirt with glasses with a smile. Thank you, Sean.
Emily?
Hi, my name is Emily Rogers. I am with the DD Council, and I'm really happy to be here. It's sunny where I am, and my visual description is middle-aged lady with short hair and glasses. Thanks for coming. We're glad to have you here.
Okay, Emily and Eric. Okay. So
Today's Advocacy Day is all about supporting families and the various supports all families need to support their loved ones. Without further ado, let's bring up today's first speaker, Kathy Muraashi, who will give us a quick overview of our.
I know. Sorry.
Great. Good morning, everyone. I'm Kathy Murahashi, and I'm the Public Policy Specialist here at the Arc of Washington. I'm an older mom, and I have blonde hair, and I wear glasses, and I am happy to be here. And I'm wearing kind of a green and yellow shirt. So thank you for being here. And I'm going to, let's see if I can get my screen to move here. Today, we're talking about supports for families. And the big picture question is, how can we ensure that families have the supports they need? So some things about families. Families are the long-term care system for individuals with IDD. There are about 16,000, about 55% of adult clients live with and receive care from either a parent or a relative. And of those, there's about 2,000 that have their person with a disability is over the age of 40. So that's a lot of folks that are caring for older folks that are caring for people with IDD. Let's see. So where do people live? This is an interesting slide, but you can see that of the DDA clients, 77% live with a parent or a relative. And that means they need a lot of support, right? A lot of those are kids, but it's important to note, that we're really the people that are going to be providing care for people with IDD over the course of time. This is just an interesting slide for you to see. This is the average monthly waiver cost. And some of you may not know, a waiver is a developmental disabilities waiver. It's a Medicaid waiver that provides a list of particular services beyond the regular medical things that Medicaid covers. It's things like job coaching and respite and residential care and community engagement and community inclusion, those services. So I think this is just kind of interesting to note. The very first the top things talks about community support, our community first choice. That's personal care. Then that's a different thing. And the average, and that's a really important thing. That's actually not a DDA service. That sits in a little different place in our system. And the average monthly cost there is about $4,899, right? Dollars a month, which is pretty good. But I want you to look at the IFS. That's a specific waiver for families, mostly kids, who are living at home with their families. The average monthly that is spent there is just $143 a month. And for the basic plus waiver, again, those are people mostly living with their family members. That second one down, that's the average cost is just like about $1,020 a month. That's not very much considering the amount of support families need. So I just put that there because we don't do a really good job of supporting families when their individual lives at home as compared, and you can see the difference. And there's reasons that the core waiver and people that are in residential is really high, but comparatively, right? The difference between $1,000 and $17,000 is quite large. And it seems like we just haven't done a lot of good investment there. So I wanted you to see that slide. So families, what are the kinds of things that families need? They need affordable, accessible, reliable childcare and after-school programs. They need funding for supports to give individuals meaningful things to do. So while the family members work, and that helps to provide financial stability to the family. Families, need to make sure they have income. Families need an occasional break from caregiving. And sometimes the person needs a break from their family too. But it's important that those are having a break. We need a reliable network of well-trained care providers. We all know that it's super hard to find caregivers right now, and it's super important. If we don't have that, then a lot falls on families in providing care, and they don't get the support they need. We also need timely and easy to use services, which is kind of sometimes becomes an oxymoron, right? We need them to work for us, and we need them to have the services. We need them when we need them, and they need information and support, and then assistance navigating systems. And then for our aging family caregivers, they need support to plan for the future. And they need assurance that there's going to be things in place when they're no longer there to be able to provide care. So really important things that families need. So, okay. That is just kind of a big overview about supporting families. And then we have some great speakers. So back to Sean, I think. Let's see, stop sharing.
I'm going over to Emily. It's
So next on the agenda, I get to introduce a lady I've worked with in several different capacities over the last few years. Her name is Tracy Hoppus, and she's with Parent to Parent, statewide Parent to Parent, I believe. And she'll be talking about families' need for emotional support.
Thank you, Emily. Good morning, everyone. It's so nice to be here. I am going to share my screen if that's possible. Let's see here.
Oh, let me see. Just a second, Tracy. I have to make you one of the co-hosts to do that.
Okay.
Hold on.
And Kathy, unless you have it and would like to share it as well, that would be fine.
I don't think not that I can get too easy. Let's see,
Okay,
where are
that's
you? I don't see your name. I'm trying to find your name.
Wait, I think I was able to do it. Can you all
Perfect.
see a slide presentation? Yes.
Perfect.
Thank you. So, as Emily said, I am with Washington State Parent to Parent programs. a network of family support programs, and I'm here to tell you a little bit more about that network and why family support is important. Here's a little about me. First and foremost, I'm a mom. So I am Andy, Sarah, and Mark's mom. This is Andy. Andy is my son who experiences developmental disability. And this is a fun picture of Andy and I on Halloween several years ago. I've been managing Washington State parent-to-parent programs since 2019. And I also live and work in Yakima, where I manage family support services at Children's Village. So what is parent-to-parent or P2P? So we provide social, emotional, and informational support to parents and caregivers raising children with developmental disabilities and or special healthcare needs. This is a program that is for parents and caregivers by parents and caregivers. Peer support. Our mission is to walk alongside those parenting children with developmental disabilities and or special health care needs, connecting them with peer support and information so they can take the next step. So next step is really important because that looks different for every family, depending on the age of their child. Could be a child that's birth to 3 or a little older, or adult children as well. So that next step is a really important piece, but we're there walking alongside families. We are a birth through life program. So often we meet families when their children are very young and maybe they have a new diagnosis that they're navigating. And we support that family through the ESIP program, developmental preschool program, grade school, transition to adulthood and into adulthood. So we are there for families long term. We are a proud program of the ARC of Washington State, and we are hosted locally by 25 agencies that include ARC chapters, behavioral health organizations, hospitals, health districts, nonprofits, and more. We have state funding that includes the Developmental Disabilities Administration and the Washington State Department of Health Children and Youth with Special Health Care Needs program. We also rely on strong community partnerships at that local level. We have great connections and collaborations with local agencies to really help us do this important work. We also receive funding at the local level. So United Way, for example, supports many of our programs. For more information about parent to parent, we've got a beautiful page on the ARC of Washington's website, and you can find it here. We also have a Facebook page. So just a little bit about our history. Parent to Parent was actually born out of a group called Pilot Parents that started in the mid 1970s in the Midwest. And they found that when parents support parents, lots of great things happen. And not only was it helpful, but they found that it was critical that they supported one another in this journey. In Washington State, we were established in 1980 with the first program in King County. Today, we have 27 programs and 50 plus coordinators who are also parents raising children with developmental disabilities. We have 14 programs with multicultural coordinators offering Spanish language programming and African American programming. We serve every county in Washington State. And you can also find a program map and contact information on the ARC of Washington's website. Here's some data just so you can see some numbers around the work that Parent to Parent is doing. So last year, we had a little over 61,000 parent connections for support, information, and referral. We had over 52,000 parents and professionals on mailing lists. We facilitated 483 parent matches. That is the cornerstone of Parent to Parent, where we match one parent with another, often based on the child's diagnosis, but could also be on other kind of social issues, transition to adulthood, that kind of thing. We had almost 37,000 social media followers, 5,400 parent connections with parents and caregivers that speak a language other than English. We had nearly 900 trained helping parents. And then I just wanted to include a few quotes from our satisfaction survey. So at the state level, we have a satisfaction survey that goes out to local families so they can tell us how we're doing. And they provide excellent data and help us get better and better as a family support organization. But the anecdotes, the stories, these quotes from families are so powerful and so valuable. I'll just read one. I'm going through a very difficult situation and the coordinator gave me a lot of information and support. I'm so grateful for the coordinator's time and kindness. Thank you, parent to parent. All right, I will stop sharing.
Great.
Thank you so much.
Thank you, baby, for coming. Now
Next up, it's my honor to welcome Christina Mondita, the Director of Public Affairs at Kindering, to talk about early support for families.
it's so beautiful.
Is she here? I'm not sure if I see her. We may have to go to the next speaker and come back.
Okay, so I believe I have the next one to
Now it's my pleasure to introduce Liz Carley from Northwest Center to talk about the need for child care for families.
Olivia.
Good morning. Yes, I'm here. Good morning, everyone. Let me go ahead and share my screen. All right. Can everyone see my screen?
Yes.
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 All right. Good morning. Thanks for having me. I'm Liz Carley, and I am the Program Development and Evaluation Specialist for the Northwest Center Impact Program. And I'm really happy to be here to talk with you about our program that supports childcare providers with inclusive practices. So Impact is a part of Northwest Center, which is a large nonprofit that's based in Seattle that was founded in 1965 by parents who refused to accept the prevailing notion that their children with developmental disabilities couldn't be taught. So these parents banded together and founded Northwest Center. They hired teachers of their own to develop educational programs targeted to children with developmental disabilities. And our founders also authored and passed State House Bill 90, the Education for All Act, which opened the doors of Washington state schools to children with disabilities. The bill was signed into law in 1971 and served as the model for federal legislation, the Education for All Handicapped Children of 1975, which we know today as IDEA. So we're really proud of our long history of advocacy within this field and inclusion. And we've been offering inclusive early learning since 1965 and early intervention, now renamed early supports, since 2004. And today, Northwest Center operates as a social enterprise model and offers also supported employment services for adults, as well as businesses that provide funding to support the mission services. So Impact, our specific program within Northwest Center, was founded out of our history and experience with inclusive early learning and ESIT, early support for infants and toddlers services. Impact was created as a hybrid solution that allows us to reach more children and help address the lack of access and resources that providers and families experience. Families experience a lack of high-quality, inclusive childcare options for their children. Northwest Center schools and many other schools experience very long wait lists for childcare slots for young children. And children with disabilities or behaviors that are challenging for childcare providers are expelled 3 times more often than children without. And parents and families are left without childcare and want their kids to be included in early learning settings. So a survey was done, and we found that childcare providers showed that they wanted to be inclusive, but they lacked the funding, the resources, the training, and the supports that they needed to include children with disabilities or with big behaviors in their programs. So in 2018, we launched Impact as a solution to all of this. So Impact is an acronym that stands for the Inclusion Mentorship Program for Increasing Access in Childcare Team. And Impact's mission is to make inclusive early learning accessible to all. We believe with training and support, educators will have the confidence and the skills that they need to support the increasingly diverse needs of children in their care. So we provide training and consultation to early learning providers to offer inclusive environments where children of all abilities are not only welcome, but are fully included and can really truly thrive in the classroom. Services are delivered by a multidisciplinary team with backgrounds in early childhood education, special education, early intervention, and also mental health. Impact supports most agencies and providers who support children aged birth to 6. And other people who found value in our trainings include early elementary educators, early intervention providers, home visitors, as well as parents and families. Our goals are to support early learning programs to increase their capacity to offer high quality inclusive environments, to welcome children with challenging behaviors, disabilities, who may need more support throughout the day, and to also prevent expulsion. In the United States, kids are expelled from preschool at a rate 3 times the rate of K-12 expulsion, with the main reason cited for expulsion being what they call challenging behaviors. So we launched in 2018 with a grant to serve just King County childcare providers and expanded in 2023 to a nationwide model through the addition of an online learning management system that offers on-demand courses for low cost that are accessible to anyone. We now have learners in our online school in 40 of the 50 states across the country, as well as internationally as well. This year, we are excited to be offering free courses and trainings to Washington State childcare providers through new Washington State legislative funding. So free courses for childcare providers serving children birth through age 6 in childcare programs. Our trainings are STARS approved, which is the professional development that childcare providers in Washington State are required to take every year. And topics offered include trainings on behavior, sensory strategies, autism, ADHD, language development, and various other inclusive practices in early learning. We also offer consultation services for programs that are looking for more ongoing support that include classroom observations, reflective practice, goal setting, and more. And we would love to connect with any and all of you. So keep us in mind if you know any childcare providers who you feel like could use our supports. We would love to be able to offer free courses to as many providers as possible this year with our new Washington State funding. And we're also launching a new pilot project for a new inclusive classroom rating tool that we're developing. So if you know anybody who might be interested in that as well, would love to connect. Here's my contact information, and you can find our website there as well. Thanks so much for having me today.
Thank you, do we have any? Do we have time for? Yeah, we do. Do we have any questions for Liv?
We have questions. And you could also ask for Tracy. We didn't take time after Tracy if there are questions for as well to this point in time.
I see a question that just came in for me. Thanks, Sue. Do we do parent trainings? We don't do trainings specifically designed for parents or geared towards parents, but we have had parents take our online courses and have expressed that they've been really valuable for them. So I think while they're designed for early childhood educators, a lot of the content can be applicable and interesting for parents as well. Oh, my email in the chat for sure. And I think I also see a hand raised. So I don't know if I can unmute you. Oh yeah, go ahead.
Hi.
Hi.
I think it's my hand. It's raised. Sandy Gruberg with Parent Coalitions. This is so interesting and so needed. I do have a question for you about we've experienced in private schools a lot of, oh, we can't do that, we don't have the staff, we can't meet your needs, where they're not required to, beyond ADA. So do you offer those trainings also at a fee, obviously, to private schools and private childcare centers?
Definitely. Yes. We've found that oftentimes private childcare centers have the highest rate of expulsion. And as you've mentioned too, even, elementary schools that are private or independent schools, they're not bound to, and they don't have access to the same resources that a lot of public schools do to serve children with disabilities. So yes, definitely we've served a handful of private elementary schoolers working with their kindergarten and pre-K programs, as well as private childcare programs as well. So yes, we're open to working really with anybody who's interested in being more inclusive and who feel like they need some support. Good question. Thanks, Sandy. My email's in the chat. So yes, please reach out. I would love to connect with anyone.
Thank you. Thank you, Rev. I don't see anything else coming about the over to Emily.
I just was wondering if we were going to go back to the person from Kindring. If there
Is Christina here? I don't think she's here. I sent her an email, but I don't see her in the room. So let's go on.
All right. So next I would like to welcome Katie Scheid from PEP. And she is going to be talking about families who need financial security.
Hi, thanks for having me. My name is Katie Scheid. I'm from Redmond, Washington, and I'm the unpaid caregiver for my 4-year-old daughter, Millie, who requires complete care. And so that caused me to kind of rally together with a bunch of other parents who want to change the laws in Washington state to allow parents of minors to be employed caregivers in the same way that parents of adult children can be now. We have 2 bills that are running through both chambers at the moment. We have House Bill 1200, which is sponsored by Representative Jamila Taylor. And we have Senate Bill 5211 that is sponsored by Senator Noel Frame. We have a hearing for our Senate bill on Monday at 1:30, and we are gearing up for that. Currently, the state of Washington, like I said, allows parents to be a caregiver once their child turns 18, but will not allow that same opportunity to parents of children under the age of 18. And this is not true in so many of our neighboring states like Colorado, California, Arizona, Minnesota. Well, that's not a neighboring state, but we've seen many states that have allowed this, especially during COVID. We saw 38 states allow parents to be paid caregivers for their minor age children, but still not Washington. We believe this policy is inequitable on its face, it's discriminatory, and it significantly reduces children's utilization of their needed Medicaid services. Across the, I'll skip ahead here. So this would impact 4,700 children in Washington who meet federal criteria for institutional level care. And they've been allocated these in-home Medicaid personal care hours. Sorry, getting a phone call at the moment. In Washington, we have a caregiver workforce shortage like we do in so much of the country, and families can't find caregivers to hire. This has resulted in 41% of children's allocated hours going unused every year. Parents like myself are often forced to leave the workforce to provide this extraordinary care uncompensated, leaving the child's entire family in financial crisis. We believe this restriction disproportionately impacts women, single parents, people of color, low-income households, and families with language and cultural access barriers. The cost of the bill, for those that are wondering, is merely just the use of these children's funds. So because 41% go unspent every year and the state budgets off prior utilization, they see that as a $25 million yearly cost. No, we did have to make some changes to the bill this year because of the state's budget deficit. So there's an extended rollout period now that will only include the highest categories of children until 2031. And at that point, all children who qualify for personal care on a DDA waiver will be included in this policy. I think that's about it. If there's any questions, I would love to take them. If you guys are allowing questions, sorry if you're not.
Katie, so thank you for clarifying which group it is. Can you talk about specifically about some families may be interested in the categories that this bill covers, will cover for this particular upcoming year?
Yeah, it will include the E category and the high high B category. B is in boy and E is in an elephant. Those were categories that were chosen by the department in their proposal. And so we decided to align with them. We do not believe that those are necessarily the categories that need this policy more than anyone else. We just had to start somewhere to reduce the cost for a slower implementation plan to allow the state to start budgeting appropriately for the hours they've already promised, right, that have gone unused due to the lack of caregivers able to fill these hours. Now, last year, DDA did request another $15 million budget reduction for personal care hours because even more were unused last year. So this is the problem we're facing, is the budget for these personal care hours gets reduced year after year as children struggle to access the hours, as families can't find caregivers. So now the budget is dwindled down to such a tiny amount that we have to ask for that money back like it's a new budget request. And that's been very frustrating and been a big hurdle for us to overcome with this very simple policy change.
Mhm. I see a question in the chat box. Let's see, ours is Katie. Oops, no, sorry, it moved. Hold on, I gotta go back up. Katie, does the bill address poor reimbursement rates to caregivers?
No, it does not. It's aiming to make virtually no changes to the system, keep everything exactly the same for parents of children as it is currently for parents of adults. Doesn't mean there's not things that need fixing, but this bill is narrow in scope and really trying to just allow employment eligibility for a group that is currently prohibited from being allowed that.
I also see another question. Ayan's asks, will this be only for those who have nursing needs or just any parent with a child with disability that can be part of this ask in the bill?
That's a great question. So in order to be included in this bill, they would have to be allocated personal care hours. That's assessed by DDA. And that means, and they use the term categorically needy, meaning that the child requires institutional level care. And that's what qualifies them for these in-home care hours. And so the child would have to be eligible for personal care hours. They would have to be DDA eligible because we do have to serve these hours on DDA waivers. And well, I think that's it. Those are the only two. Yeah, so it wouldn't apply to all children with disabilities, only those that are eligible under those two requirements. Tammy Bowen?
Thank you. This is Amazon. Does the bill have safety parameters to protect the person with a disability? I know that there are many parents that are wonderful parents. However, there are parents that do this for the income and gain more control over their disabled child. That so I want to make sure that there's safeguards in place, such as they can't gain total control over that when they turn 18. So I hope if I'm not making sense to you, please let me know. And can you understand me?
I'm sorry, my phone was cutting out a little bit. Kathy, were you able to tell me what the question was?
Yeah, she was asking what protections are in place in this bill. She's particularly worried about parents that become over controlling for their particularly older child, and what protections are in place in this bill for that.
Yeah, that's a great question. So the DD ombuds, we've spoken quite a bit with them about the bill, and they are signed on to the bill. So currently, the same safeguards that are in place for an adult, we're wanting as many of those safeguards placed on parents of minors as possible. So I think outside, so another representative, right, has to be an authorized representative. So the same the same things that would allow a child, 18-year-old child, to choose their parent provider, we're hoping would be in place for a minor. Now it is tricky because a minor, the parent is technically the one that makes the choice for them. So those are really good questions. And I think that we're going to follow CMS guidelines in regards to how other states have done this. And what other protections might need to be in place just because of that slightly different relationship between a minor and an adult. But the safeguards that are there now, we would hope would be applied in the same way.
Deanna?
Hi, my question is, you've talked about these hours being for the children that are awarded personal care hours. But, and I kind of see it was addressed in the chat, but those that are awarded nursing hours rather than personal care that are in those categories that you've mentioned, would they also benefit from this bill?
Yeah, so when we started working on this, we were wondering, should we focus on PDN or should we focus on personal care as a group? We're 1,200 now impacted people or people working on this bill. And we decided to go the personal care route because it includes everyone. And the way that it does that is if a child is allocated nursing hours, they can exchange out those hours for personal care hours. They have to go through an ETR process through DDA. I wouldn't say it's necessarily simple, and most things with DDA aren't, but it can be done. So this would include all children that qualify for personal care, where the nursing side, I actually just heard today, there is a bill that just dropped today that is going to allow parents to be paid for their child's nursing hours. And they will have to do a separate trainings and certifications and have a lower pay rate than a nurse. But we believe that's all important too. But I heard it's only going to serve 200 children. Now that's rumors. I don't know for sure, but that's not even covering all the children that qualify for nursing hours. So I'm confused by that one. So this would include all children, but they would have to move hours from nursing over to personal care.
Perfect, thank you.
Thank you.
Thank you so much, and thank you for all of the lovely questions. It really helps all of us understand better, and thank you, Katie, for letting us know and giving us such good information. Next on the agenda is Sandy Gruberg and Michelle Williams, statewide parent coalitions. And their topic is families need support and help navigating and advocating.
Thanks, Emily. Michelle Williams is not able to be here today because she had an appointment with her adult son. She's a caregiver, parent caregiver too. So I am happy to bring our thoughts and concerns to the group today. My name is Sandy Gruberg, and I am the parent of a 25-year-old daughter who utilizes DDA services. I'm also the communications co-coordinator for statewide parent coalitions. I've been asked to talk about the importance of information and system navigation for families. So when families first hear the words developmental delay or intellectual disability, it's often from a doctor or preschool, kindergarten teacher or therapist. Those initial indicators prompt wraparound programs of early support, IEPs, and medical care management. However, when it comes to voluntary DDA home and community-based services, we know that families can fall through the cracks between early intervention and DDA age 4 enrollment. If that gap is not filled with support and navigation, the next time a family hears about DDA could be when their loved one is in a high school transition program and trying to access employment and day services. By that time, years of support and learning and skill building may have been lost. When families apply to DDA on behalf of their loved ones, they can be met with unclear eligibility criteria. We're all seeing that right now, and confusing service terminology that doesn't clearly speak to their unmet needs. Even eligible individuals often wind up on the no paid services list because they didn't specifically request help, even though it was needed. Multiply that barrier for individuals with language differences, and the problems intensify. Families need family advocates. As a family advocate myself and a parent support professional, this is what I'm hearing, as many family advocates are hearing as well. No one told me about DDA. The application is too hard and the wait is too long, and we need help now, not 19 months from now. I can't figure out if I'm eligible or if my child is eligible. I don't understand the waivers and I don't know what services to ask for. I can't get help from DDA in the language I speak. And I don't understand the system at all. So statewide parent coalitions, information education organizations like Pierce County Coalition for Developmental Disabilities, where I work for parent coalitions, and even unpaid parent advocates help guide families through these barriers and connect individuals with needed services before a crisis occurs. So what are we asking today? Families are asking DDA to continue funding information education and system navigation support. Families are asking DDA to continue partnering with nonprofits who are working side by side with families to reduce barriers to service. Families are asking everyone at state, county, agency, and advocacy levels to listen to family caregivers. Family caregivers alone are the experts on what family caregivers need. And finally, in the spirit of nothing about us without us, families are asking this state to recognize and support a necessary family advocacy network, a network that ensures that diverse family caregivers, with or without organizational privilege, have equitable opportunities to advocate at key decision-making tables. Thank you for your care and attention today. Are there any questions?
Thank you, Vanny.
Sean, I think Michelle is here, Lahosky, and she's gonna talk about senior families for us.
I have no more questions for today. My name is Antonio. It's nice to meet you, everyone.
Have a good day, Antonio. Yeah. Yeah, but don't go ahead.
Okay, so hi, I'm Michelle Lahosky. I'm the director of Pierce County Coalition for Developmental Disabilities. I'm a mother of 3 sons, and my youngest son experiences the condition of Down syndrome, and he's 37 and he lives with me. And one of the things that I have experienced through my time being his mom is that it's been very hard to find other caregivers outside of the home. And it comes a time where I got sick and I needed to help him find his forever home. And right now, there's not really a good way about doing that. I know that you use, the state utilizes community homes for community living and help people who are leaving the institution into the community. But systems navigation is also needed for aging families who have to have their child move into the community because they no longer can care for them. Parents need to understand their own long-term care needs that they're going to need, financial issues that come up with that as you age and you have to move out of your home and into a facility. 55 and plus communities will not take the loved one who's younger. They'll take the parent, or they'll find a home for mom, but they won't accept the individual with disabilities that would move in with mom, or bring those supports to that home so that they both can live together as a family. So when most families think about what's going to happen when I'm no longer here, and when I think about that, that could happen tomorrow morning for my son. I may not wake up tomorrow. I'm getting older. My body could just say, I'm done. But there's nothing in place. There's a crisis here. There's nothing in place for my son, Kyle, even though he has a case manager. Yes, we have friends. Yes, he has a brother. But that still does not give him a place or security of what's going to happen if mom's not here. So prioritizing senior families is receiving services, including preferences for the core waiver. So right now, if you're usually when the individual lives at home with the parents, they're probably only on the basic plus. If the family immediately, if the parent who's the caregiver passes away and the individual with disability has to move in the community, they only have a core waiver. So their only options in the community would be an adult family home or a group home. And there's not a lot of them out there available. I've been looking for the past 3 months and there were 2 homes that I was sent to. So I'm just letting you know that, you know, if parents can't plan and make it happen, it's not going to happen. We also need somebody to come in like that systems navigation to help families work through that, or even person-centered planning, utilizing for future planning to help the family prioritize where that's going to be. And we need to dedicate navigators, utilizing those info ed people who are already helping families navigate through there. So, and when the family goes into a crisis and they can't get a hold of the case manager, there needs to be some place that people know. Families need to know how to plan ahead, maybe have a book of if this happens, then this kind of a thing. Anyway, I have a lot of passion for this part because I'm living it right now. I really wish somebody was there for Kyle to be able to help him understand what is, mom's not going to be here anymore, and help him make the choice of where he wants to live. While I'm here, I'm always going to make sure he has a choice. But after I'm not here, I'm sorry because his not understand, people may not understand what his wishes are, and that concerns me a lot. So that's me.
Thank you, Michelle. I see somebody has a question. Emily?
Hi, that was wow, that was powerful. Thanks for sharing for that. I have kind of similar kind of situation too. Like I have learning challenges disability, but I call myself neurodivergent because I prefer that. But anyway, my boyfriend also has a disability and is like, what happens if we decide to get married one time and live together? Where I right now live with my mom in my mom's house with my sister, and then he lives with his parents. So, like, how we gonna live? Does that mean he and I gonna live with his parents, or are we gonna live? Or am I gonna have him move in with my sister and I? Because I was like, what do you do about that situation? When you get to that point, you know, it's hard because we also want to have our own space. What do you recommend on that part?
It's a lot of planning for sure. and they have to kind of consider all your benefits and what you have available to you and what kind of supports you have and services you have. But good questions, because we want people to have the life of their choosing.
Oh, sorry, I was raising my hand. Well, my name is Antonio. Nice to meet you, Michelle. I'm talking to her, Michelle Wesley. It's nice to meet you, Michelle. If your son, he wants to talk with you, I understand I know you're feeling with that long face for today. You're feeling sad with that pain. For me, I met a friend in a high school before the pandemic. She lost his dad in the past. I told her many times, you got friends, you got me, I understand. And now she got a stepdad. She was a junior just like me, but I'm feeling worried about her. And well, that's in the past for me. I understand. It's nice to meet you, Michelle. Be strong.
Yeah, be strong, Michelle. Thank you for that. Sorry, because I I think I have a similar story with my family, so thank you for sharing that. I believe I'm not gonna hand it to Eric. I'm gonna introduce our next speaker.
Thank you, Sean. I would like to introduce our next speaker, Taylor Crisp, and speaking about parents with IDD need and support.
Eric, and thank you, Sean, and thank you, Michelle, for highlighting that. My grandparents also went through that silver tsunami and passed away in a car accident before when and my uncle was high support needs. So my family was also went through that. I also am just happy to see so many parent representation here today. For those who don't know me, my name is Taylor Crisp. My pronouns are she, her. I reside in Spokane County, and I'm not only just a mom, but I also live and have autism. And my support needs kind of they kind of vary. It may seem like I'm low support needs, but there's some times where I have my struggles that people don't see. And while my experience as a parent with a neurodivergent child may be slightly different and unique than other parents, I still live with some significant challenges other parents that don't have an intellectual developmental disability like me have. When I found out I was expecting my daughter, I realized I needed some more help and services to help me start the journey of becoming a mom with a disability. I applied and lived off a variety of social programs, especially after becoming a single mom. I became a single mom shortly after I gave birth to my daughter. My daughter's dad couldn't handle being in a relationship with someone with a disability. So I became a single mom, experiencing those challenges of parenthood while experiencing a disability myself. I applied for a variety of programs, and I heavily relied on food assistance, SSI, parenting classes, Medicaid for both me and my daughter. But most importantly, I relied on housing. I had to navigate a lot of those systems on my own. I had to ask for a lot of help, and sometimes when you additionally have a disability and have to become a single parent, navigating that system becomes hard in a different way. So that was really challenging. And I even had to take parenting classes because I needed that extra support as a person with disability to become a parent. So these federal and state programs were crucial for me and my daughter to survive and get us on our feet. And it was also challenging because I didn't know a lot of people in my situation. I thought my situation was pretty unique because I faced a lot of judgment becoming a parent with a disability. If anyone has ever seen the movie I Am Sam, that was my experience becoming a single mom firsthand. I had to rely heavily on my parents for financial help for court custody to deem that I was a fit parent, because society still seems to think that if you have a disability and you're a parent, you can't, sometimes they don't see that you can still become a parent and have a disability at the same time. Without those social programs and federal programs and the support, I probably, I don't know what I would have, where I would be today and what where my daughter would be today. And now because of those social and federal programs I relied on, my daughter is thriving in middle school and playing an instrument, and she's doing really well. And she even though she's neurodivergent herself, she knows her mom, me, well enough, and she knows, she can tell when I'm stimming or struggling, and she will hug me, and we are there for each other. So I wouldn't trade, while that was a challenge, I wouldn't trade that experience for the world, but just I wanted to reassure that these federal and social programs are important for people in my situation to rely on. It helps us get through these hard times. And it's also important to, we can't ignore the fact that parents can also have an intellectual and developmental disability. We exist. And because of that help and support, that's why I'm the self-advocate I am today. And that's why I've been able to meet you guys. So we need more, so we need supports taken away. I don't want to see another single mom with a disability without those supports. So it's important we advocate for more supports, and supports not to be taken away. Thank you.
Hi, Taylor. My name is Antonio. It's nice to meet you. Well, when I enjoy my weekends, real sad. I've lost everything when I was graduating the big day at the Cargapson Senior Center. And then what makes me sad, it was my grandma. She was feeling super sick on this June 21st. On July, she passed out 13 on Saturday. She was in Mexico, not USA, Mexico, Michoacan. And I was staying out in the United States all by myself with my dad. My party was canceled. And then my grandma, she passed out the last day of 2023. They buried her and on that cemetery with my aunt. She missed his father. They buried him. And now my mom, she's suffering, again, she visited her on 2024. That's the last day. Don't be sad, Taylor. You got friends. Miss Tracy, Sandy, and you got me. My name is Antonio. I'm working with the ARC County. You got Miss Courtney. You can work with her. She's the manager. I'm Mr. Antonio. I'm working with her. I'm sending the emails. So she can just give you her phone number. I can give you my phone number. It's for texting or calls.
Awesome. Thank you, Antonio.
Thank you, Antonio, and back at you.
You're welcome. Just let me know.
Thank you for
Calls.
sharing your story, Taylor, and also Antonio. That's really heartfelt.
Thank you, guys. Thank you very much.
I believe I don't see Representative Baba. Yeah.
No, I don't see her yet either. She'll come if she can. She may
So,
have.
yeah.
Mhm.
So do you want to talk, Kathy, and update us on the bills of interest then?
Yes. I'm going to pop the link into the chat box about where you can go to see bills. And I'm going to share my screen here. Just a second. I'm going to make this just a bit bigger so you can see. Okay, where's my share screen thing? Hold on. There it is. Can you all see that?
Yes.
Okay, now I got to find you guys again. Okay, super. So, whoops, hold on. I'm gonna bill tracker. Okay, I'm gonna scroll down. When you go to the link, I want you to notice something, that there's two columns. One says bill tracker. The other says general tracking. The bill tracker is more specific bills that are very specific to IDD. The other one is general tracking, has some bills that probably were within the bill, but it's not all of, it's not specific to IDD, but it may have impact on us. So I want you to make sure that you can know that, and we'll talk a little bit about both sets of things. So let's talk about housing bills today. A few things that we're seeing. There's 1217 and 5222. When there's a House bill and a Senate bill, we call those our companion bills. So they're the same bill, but they're just both in the House and a Senate. Some have companion bills, some don't. And those two bills are about improving housing stability for tenants, and it limits rent increases and requires specific notifications, and limits fee increases, and such. And those two bills have had a hearing. Let's see, one of them actually has a hearing today. The Senate bill has a hearing today at 1:30. And so that if that bill is important to you, you can look it up there. There is also House Bill 1010, which authorizes accessory dwelling units in rural areas. So sometimes people like to build like a cottage in the back of the home. Maybe it's the parents that live in the house and they build a cottage for their loved one in the back, or other kinds of opportunities. And the reason that's important to some folks is that it may allow for more housing opportunities. And sometimes cities and jurisdictions limit where those can be, particularly in rural areas. So this bill would help to expand that, which may be important to some people. Civil rights. So we've got a couple of important civil rights bills this time. One is 1390, House Bill 1390, and it repeals the Community Protection Program. I saw, Noah, are you here?
Yes. Hello.
Do you want to give 2 sentences about that bill?
Yeah, so this is Noah from the DD Ombuds. This bill would take the community protection language out of our state statute, but because the waiver goes through the federal CMS process, people on the waiver would stay on that waiver until DDA updates their waivers. So services wouldn't change right now. This would just give DDA some flexibility on how they support people in community protections, and for a later change that people could give input on when the waivers change.
Thank you, Noah. So you can watch that bill if it's important to you. It's in House Early Learning and Human Services. So big news this morning, there are 2 bills, House Bill 1472 and Senate Bill 5393. And these two bills would close Yakima Valley School and Rainier School. That's a big deal. We think that's a civil rights issue. Many other states have closed all their institutions, and we still have 4 in our state. And this would shrink it to just 2. It is in-house early learning and human services, so you can let your legislators know how you feel about those bills. There's a bunch of education bills. One of them is 1051, which permits recording of IEPs. We're still looking at that. We're not sure what all the implications are there, but that's an interesting bill, and you may want to look at that if that's important to you. There's a bunch of, like I said, education bills. Some of them sound similar. 1241 improves access to and provide the provision of a free appropriate education. And that's by Representative Paulette, and you'll see he has several bills. So there's various things in there. I don't know. I think Ramona had to run. Are you still here? I think she had to run. Usually I would have had to check on her. There's a lot of the bills, they sound sort of similar. So you may want to go in and read the various bills. 1257 and 5253 extends special educations to students until the end of the school year in which they turn 22. Right now, it has been, if you turn 22 in the middle of the school year, that's your last day of school. Now it'll say at least when you turn 22, you get to stay until the end of the school year. So that is in-house education and early learning. And that's important, Bill. Here's a bunch of special ed funding. 5263 is about special ed funding. It does a bunch of different things that are good. And also 1310 and 5307 all do expand or improve on special education funding, which is great. On 5263 and 5307, there is they were going to request that they include, when they're in their funding formula, that they include the 3 to 5 year olds in that. I don't think that they did, and that was really important. So we're asking Peterson and Wellman to include the birth to 3, those younger kids in that as well.
Kathy, was that birth to 3 or 3 to 5?
I have to go back and look.
Okay. I was thinking it was ESIT.
Yeah, I think it's ESIT. Yep.
Okay.
Stonier's bill does have the ESIT language in it, and we're asking that Stonier's language from that bill get popped into the other 2 funding bills, actually just as a safeguard. But the ESIT language that reconnects it to the multiplier. Is in Stonier.
Okay.
Yeah.
Thank you.
Yep. Stacy, do you have any other comments about the education bills? I know you're more up on them than I am.
Yeah, sure. This is Stacy Dim at the ARC of Washington State, and the main vehicle, probably the most comprehensive bill, the companion bills under Representative Paulette and Senator Wellman. Senator Peterson takes a slightly different approach with less funding, and so I don't know what the conversation might have been between Senator Peterson and Senator Wellman, but it's not unusual for legislators to take slightly different approaches to things. And then at some point, there'll be a compromise. So we're just tracking them both. They're all 3. They all add critical special education funding, address the cap, which we'd like to get rid of, increase the multiplier. One of them addresses safety net. And so all important elements that we're just watching for as these hearings unfold.
Yep. And there's hearings today at 1:30 on 5263 and 5307. So it's same committee. So if you're interested in those,
the fiscal notes would be really high on these. And so we're just, again, watching to see what's the legislature going to be willing to do.
Yeah. 1357 provides special education funding and support for inclusionary practices, which is great. So you can watch for that if that's important to you. Let's go down to adequate services and networks. 5125 is about the funding, supported living, making the rate the same between Snohomish County and King County. It's not currently the same and they're asking for it. That bill's been around a couple of times through. So I know they're giving it another try there. 1158 would move community inclusion, the service, from the counties being the administrator to it to DDA. And that has a lot of things to think about, you know, how that would work and if DDA is prepared for that. And it doesn't increase anything for anybody or take anything away, but we're yeah, it would just, the function of it would be different. 1493, let's see. This is a new bill. CEA is sponsoring it. Aaron, are you here? He must not be here. So what it does is it lowers the age from, currently it's 21, and it would lower it down to 19. The age of which individuals may receive employment services. So the thought behind that is, you know, typical folks can go and get a job, you know, when they're 16 if they want to, and this would just lower it. And the problem right now is before 21, you can't get that employment support. They have a limitation for that says on the waiver that you can't get employment support until you're 21, and they want to move it down to 19. So people, when they're still in school, could get a job. It also includes community inclusion so that people could get community inclusion. And I think the idea behind that is to begin setting things up for an individual so that when they graduate, they would have some things in place. And then they would also have a job when they leave school. So that's, again, 1493. There's also a couple of bills that would create an advisory council on rare diseases. And one of them has a hearing today at 1:30, and the other one has a hearing tomorrow at 8 a.m. This bill has been a couple times, but we're hoping that this will be the time that they get the council going. 11:30, and I don't see Representative Farvar hasn't come. We're hoping that she was going to come and talk about her bill, and she may not be able to today. 11:30 concerns the utilization of developmental disability waivers. And you heard Michelle talk about senior families. One of the things that this bill would do was prioritize individuals who are over the age of 45. The person with the developmental disability is over 45, with the assumption that they have a senior parent, right? Now, we know that ages can be weird and, you know, it doesn't always work that way, but this would get probably the bulk of folks that have senior parents, and it would prioritize them to get a core waiver and this is particularly when there may be, right now we have a lot of waivers available. If we didn't have those available, this would help to prioritize who gets a waiver. It also prioritizes some other groups. One of them, I think, is also parents who have a disability, that have a child and have a disability as well for the court. For waivers, which may be a really important service for them to have to support their child with a disability when they have a disability themselves. So this the good thing about this bill is it really doesn't cost any money. And we've talked a lot about this session's really hard because there's not a lot of money. going forward. And we're trying to prevent them from making cuts. But this doesn't cost any money. It just tells, DDA, hey, if we don't have this many waivers, this is who you should prioritize. So we think that would support particularly senior families. Katie talked about her bill earlier about the HB 1200 and 5211 about authorizing payment for parent caregivers of minor children with IDD. And I think we just heard that there is a hearing next week, I believe, on
that's
the
correct.
Senate bill. What day and time and
Monday at 1:30, Human Services in the Senate.
Great. Thank you, Katie. So if that's important to you, you can go and sign on or sign up to testify. 1344 increases access to respite care for those with IDD. What this bill does is it adds respite if you're on the basic plus waiver. There are two kind of silos. There's the respite silo, and you're assigned based on an assessment how many respite hours you have. There's also a kind of a separate menu item called aggregate services, and it has several different things on it. What they want to do is add respite to that other aggregate services. What that would do is it would allow you to use all the respite you have from your respite pot, but then you could also use, in addition, your could choose to use aggregate service respite as well. So what it would do is if you need more respite, it would increase respite for folks. That's Representative Barnard's bill. And that one just came up this week.
Happy?
Yes.
I was thinking that this was the one that was asking for increased respite reimbursement rates, the tiered reimbursement rates, 1344.
No, it does not do that. It's just it
which
adds
one
it
is
to the
that?
rest. There's not a bill yet for increased respite rates. There was a
Okay.
budget item in Inslee's budget that talked about that. So
All right.
that's what
In that link you shared earlier, in that one pager you shared earlier, it says increasing access to respite, but when you click on the HB 1344, it takes you over to that. Oh, it was popping me over to that document from Tavon that was asking for the reimbursement. So I was getting all confused.
Okay. Alrighty. Thanks.
You might have both on your computer, Deanna.
Okay.
Yeah.
We'll double check our link.
Yeah.
And just for folks that are interested in Representative Barnard's respite bill, that's not looking to get a hearing yet. And if you are interested, you might contact the chair of the House committee, which is Representative Bergquist, and tell him that really matters to you and you'd like to have a hearing on it.
Okay, and this bill just came this morning, yesterday, I believe, 1470. And it reduces the developmental disabilities at DDA's no paid services caseload services. And what it does is it eliminates case management for those on the no paid services caseload. I haven't read it completely, so I don't know if it completely eliminates it or if it eliminates it for a smaller group or not, but we may want to pay attention to that. Like I said, it just came up. One of the things that came up, there was what's called a JLARC study, Joint Legislative Auditory Audit and Review Committee. I think I got all those letters. That's a lot. That talked about this issue about case management, that a lot of people got a case manager and they didn't really want a case manager. And that wasn't I'm pretty sure that this bill is a response to that, but we have to make sure and probably want to make sure that people that want a case manager get one. So I don't know if you remember, a few years ago, we added case management back to people on the no case shirts, paid services, because they didn't have anybody that they could connect with at that point of time. So anyway, something to watch for if that's important to you. Let's see. Okay, there's just some things, that proviso request. That means we want to ask for money for certain things. We haven't seen any increases for supported living, needs wage increases. On the housing side, we're going to be asking for 50 million for DD housing. And there's that tiered respite rate there. That's where we're, kind of we wait and see and hope to see that. So that's something you can ask legislators, make sure there's money for, tiered rates for respite and increased dollars for respite. I just want you to see the other page. The ones in yellow are the DDA that are on the front page. There's some other bills here that may be important to you, that, sort of relate to us or have things that may be important to you. So, and here's that one, that new bill, the 1521, that was caregivers, the complex needs one that was around nursing care to kids, paying parents of minors. That's 1521, if that one is of interest to you. The prescribing psychologist certification, that's there as well. And there's several bills around workforce issues and background checks that may be important for you to know about. There's some revenue bills. One of them calls out set aside for people with DD. So anyway, those are kind of the broader world pieces for you. So I'm going to stop sharing and I let Sean talk.
Kathy, we did have, sorry, this is Christy. We did have some questions in the chat.
Yes.
One of them from Katie, if they close both of those institutions, does anyone know where those funds are planning to be redirected toward?
I don't know. Does the bill say anything, Stacy? It doesn't. I think that's one of the things we'll have to do advocacy around.
The
Because
bill
they
does
would
not say, so you need to keep in mind though, when they close facilities, people still need services. And so there's not likely to be a savings on what people receive. We all know that a number of the individuals in those facilities will likely transfer to the other two remaining open facilities. And for folks that want to move out into the community, there'll be other resources for them to be able to do that, hopefully. That's the kicker with this bill is, are they going to also invest in community-based services for people who want to move and transition out of those facilities? Once the facilities are completely closed, there will probably be some savings around operations for those facilities. And it's unclear if, all what will happen with all the state employees. Will they all be preserved and move out into the community or not? A lot of questions. So there is no direct line between closing the facilities and savings or how people will be supported at this point.
So when you're advocating, you probably want to say in the same breath, support community, investment in the community for those folks. And, one of the things would be supported living wage increases, right? Because you have to have that because they've got a high turnover. So I think we have to say both things at the same time.
Kathy, do we know if the capacity at the remaining two would accommodate the two facilities being closed?
Yes.
It would.
I'm pretty sure they would. Yeah.
Okay.
They used to be much larger.
We have a question. What does that mean? Reducing no paid services, caseload services?
So those people are people that don't get any services from DDA or through home and community services. They aren't getting anything. They're just eligible for DDA. And what it means is right now they technically have a case manager that they can connect with and talk with. I think what would happen is they would no longer have a case manager.
Thanks. Okay. So I believe now we're going to well, if I do this the right way.
This is Sean, and now we are going to watch a video about a few things you can do today.
I was gonna do.
You want me to share it or you want to share it, Sean?
Oh,
I can share it.
yeah, if you can share it.
Okay, let me do it. So I got to share my screen.
Sorry.
See from slideshow. Red slide. Okay, here we go. Hopefully you can see it.
Hi, I'm Sean Latham, the Policy Coordinator for Self-Advocates and Leadership.
Sorry.
And I'm Jessica Renner from Self Advocates in Leadership.
We want to thank everyone for taking your time out today to join us for Advocacy Days. We're here to talk to you about how to become a trusted resource for legislators on issues affecting your life. Even though your elected officials represent you, they can't do this very well if they don't know what you want. We want to encourage you to contact your legislators throughout session, but especially this week, about the issues that matter to you.
That's right. With so many topics for legislators to learn about, your knowledge of developmental disabilities helps them to do their job. You are the expert in telling your story and how it relates to decisions they are making. Here are some tips to help you make the most impact. Your time with legislators, staff, or aides is short, and your message should be too. When you communicate, sum up what the issue is and why it's important to you. Have a specific request related to a bill or budget item. Attack the problem, not the person. Follow up with a thank you. By doing this, you greatly increase your credibility and strengthen your legislative relationships. Bottom line, stick to what you know, which is your life, and how the issue affects you.
Here are some ways that you can reach out to your legislators. You can email them and their legislative assistant about your priorities. You can contact them through the legislative hotline phone number, which is 1-800-562-6000, and ask to leave a message for them. You can also share your opinion on a particular bill by using the hotline. We also encourage you to request either an in-person meeting with your legislators or a meeting with them over Zoom or Microsoft Teams. Please reach out to the legislative assistant of the legislator to request a meeting. You can watch the legislature at work on TVW, either on your TV, if you have the channel, or online at tvw.org. Another way you can participate is by signing up to testify at legislative hearings. For each hearing, you can sign up for the individual bills as pro, meaning you are for the bill, con, meaning you are against the bill, or other if you have concerns with the bill you generally like.
Let me now take you through the process using the Washington State Legislative website that can be found at leg.wi.gov. On the website under the menu, click on the menu item that states Bills, Meetings, and Session. From there, scroll down to the section titled Upcoming Committee Meetings and click on the link titled Sign into a Committee Meeting. Next, choose if you are testifying in a House hearing or testifying in a Senate hearing. We all have the choice to testify in person, testify by video remotely, or we can submit written testimony or just state what our position is on the bill.
After you pick one of the options, you will be taken to the form to register. You will need to fill out your position, your name, your email, your address, your phone number, and your organization, if you are representing one. It also asks you if you will testify on a panel or not. If you are testifying on a panel, it will ask you to fill in the names of the other panelists. The other box to make note of is the pronunciation box. If you want your name said right, you can sound it out in that box. Please check the box "I'm not a robot" at the end of the form, and then it's time to hit submit registration. Once you submit your registration, you will receive an email from a committee staff email address. Please read this email carefully and add the meeting to your desired calendar using the links in the email. From there, make sure you are ready to testify.
Don't forget about social media. A lot of legislators have accounts on Facebook and Twitter where you can comment or watch live stream chats and virtual town halls.
It's so important to stay informed and involved. Participate in virtual advocacy days, sign up for the ARC of Washington's action alerts, get updates at arcwa.org, and follow on Facebook. Connect with local parent and self-advocate groups. And remember, change is made by those who show up. This is Sean. Today, as you have been hearing, is all about informing your legislators and other leaders about supporting our families. As our one-pager states, families are the long-term care system for individuals with intellectual and developmental disabilities, I/DD. 77% of the clients live with and receive care from a parent or relative. Of those, 16,306, 55.5%, are adults. It is estimated that more than 2,000 individuals over the age of 40 are living with aging parents. The average monthly usage of Medicaid waiver services on the basic plus for individuals living at home is $1,020. We need to ensure that families have adequate supports so they can continue to provide care to their loved one, and the availability of residential services and supports when they no longer can provide care. Families are very often the backbone of individuals needing care. I know my mom, my sisters, and my brother-in-law have offered me a lot of support over the years. Some important things to talk to your legislators about are the need for child care services, the need for early intervention services, the need for respite, the need to help aging families, and the need to help families navigate our complex state service system. I encourage you to call, email, or meet with your legislators on Zoom or in person this week about these and other items. I will add it's very important to reach out to the new legislators, especially to educate them about our issues. Sharing your personal stories is one of the best ways for your legislators to get to know what you need. I wanted to encourage you to watch and follow the legislative process by watching TVW on the television or by going to tvw.org online. Lastly, I want to encourage you to fill out our Advocacy Day survey. This helps us understand what you like and what you didn't like about Advocacy Day, so we can get better and better. You have the option of filling out the Zoom survey that you should see on the screen now, or alternatively, you can click on the links I posted in the chat. There will be an English and Spanish link. Let us know after if you need any assistance in filling out the survey. With that, I will just thank you for joining us today, and remember, change is made by those who show up.
Thank you. Have a good day.
Thank you for taking the time to fill out the poll.
Yeah. Yeah.